Respiratory infections such as pneumonia, bronchitis, and the flu continue to pose a serious threat, particularly to vulnerable populations, yet they are often underestimated until severe complications arise. These illnesses are not only highly contagious, but can also escalate quickly, leading to life-threatening conditions if not properly managed. While many people consider the flu a routine seasonal nuisance, it remains a major contributor to hospitalizations and deaths worldwide, especially among the elderly, young children, and individuals with weakened immune systems. The growing burden of respiratory infections highlights the persistent danger they present and the need for greater awareness and preventative measures. Pneumonia, a severe lung infection, is particularly concerning because it can develop suddenly, even from mild respiratory illnesses. While bacterial pneumonia is often treatable with antibiotics, viral pneumonia, such as cases caused by influenza or other respiratory viruses, can be far more difficult to manage. Symptoms may start as a mild cough or fever, but can rapidly progress to severe breathing difficulties, organ failure, and, in extreme cases, death. Despite medical advances, pneumonia remains a leading cause of death among older adults, yet many cases go undiagnosed or are not taken seriously until complications set in. The risk is even higher for those with underlying conditions such as diabetes, heart disease, or chronic lung issues, making early detection and treatment essential. Bronchitis, though often dismissed as a temporary irritation, can also have serious consequences, particularly when it becomes chronic. Acute bronchitis, typically caused by viral infections, leads to inflammation of the airways, causing persistent coughing, wheezing, and breathing difficulties. While some cases resolve within weeks, repeated bouts can weaken lung function over time, increasing susceptibility to more severe infections. Chronic bronchitis, a form of chronic obstructive pulmonary disease, COPD, results in long-term lung damage and significantly reduces quality of life. Smoking remains the primary cause, but even non-smokers exposed to air pollution or secondhand smoke are at risk. The fact that bronchitis can evolve into a lifelong respiratory condition should serve as a serious warning about the importance of lung health. The flu continues to be widely underestimated, despite its ability to trigger deadly complications. While many view influenza as just another seasonal illness, its impact can be devastating, particularly when it leads to secondary infections such as pneumonia or exacerbates existing health conditions. Each flu season brings new virus strains, and the unpredictable nature of these mutations makes it difficult to guarantee complete protection, even with annual vaccinations. Many people still neglect to get vaccinated, believing themselves to be at low risk, yet flu-related deaths occur every year, particularly in high-risk groups. The flu can overwhelm healthcare systems during peak seasons, with hospitals struggling to manage the surge in cases, leaving those with severe infections fighting for access to life-saving care. The dangers of respiratory infections are not limited to individual health. They have broader societal implications as well. Outbreaks of flu, pneumonia, and other respiratory illnesses place immense strain on healthcare resources, lead to lost productivity, and increase long-term healthcare costs. The rise of antibiotic resistance further complicates treatment, making bacterial pneumonia and secondary infections harder to manage. Climate change and increasing air pollution may also contribute to a rise in respiratory diseases, as poor air quality weakens lung function and increases susceptibility to infections. The combination of these factors suggests that respiratory illnesses will continue to be a major global health challenge unless significant steps are taken to improve prevention and early intervention. Despite the risks, public awareness and prevention efforts often fall short. Many people ignore early symptoms, assuming they will resolve on their own, only to seek medical help when the condition has already worsened. Vaccination rates remain lower than necessary to achieve widespread protection, and simple preventative measures, such as proper hand hygiene, avoiding crowded places during peak flu season, and reducing exposure to pollutants are frequently overlooked. The persistent dangers of pneumonia, bronchitis, and the flu should not be ignored, and greater efforts are needed to emphasize their seriousness before they lead to irreversible health consequences. Failing to take these infections seriously will only result in more preventable hospitalizations, long-term complications, and loss of life.